The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today we're going to talk about medications. Are they a panacea? Is there a pill for every problem? Or are there concerns that we should have when we talk about medications? Joining us today is a specialist in internal medicine, Dr. David DeRose. Currently, you're practicing at the Lifestyle Center of America, which is really preventive medicine, which is another specialty that you have. And so this idea of medication, as an internist, and I've been a nurse for many years, I know that internal medicine specialists give a lot of medication, a very highly technical field many times in an ICU, CCU, those settings. And in preventive medicines, many times physicians that are practicing those, they try and stay away from them. Where do you fall on this?
Well, it actually is a very contextual question, like you mentioned. I mean, in the intensive care unit, we're often dependent on medications, and there are life or death issues that hinge on whether the right medications are prescribed. I have nothing against using medications in the intensive care setting, but when it comes to the common things that people see their physicians for, we're often using medications, as you and I have talked about before, Don, in such a way that we're causing, I believe, a misplaced focus in our country. And people's minds, they're thinking that drugs are the solution when really the solution is addressing lifestyle issues.
So we need to look at what we can do ourselves to prevent, stop, or reverse conditions we have rather than what someone else can package for us and then just hope, well, that's going to do it.
That should be the first line. And if the lifestyle is not delivering the endpoints that we need to achieve, then medications may well be appropriate. Let me give you a couple examples. Blood pressure and diabetes, two very common problems that people come to us at the Lifestyle Center of America. With high blood pressure, if lifestyle is not getting your blood pressure into reasonable control, and by that, I like to see that systolic number optimally below 140, and the diastolic number into the low 80s. If you're not into that level of control, you're running a significantly increased risk of stroke and heart attack. And you would be better off taking a medication for the short term, even if in the long term, lifestyle is going to help address it. After all, if somebody's carrying an extra 100 pounds, they can't lose it in a week, right?
Not normally.
No, even in our program, Don, I think the record there in 19 days is, I think one guy actually lost 50 pounds.
In 19 days?
Yeah, but this is real unusual. He had a rare condition where he was retaining a lot of fluid. So a lot of that was just fluid weight. But the point I'm making is we don't change our bodies overnight with lifestyle. Medications may be necessary to decrease risk. Another example with diabetes. High blood sugars put a toll on many organs. One of them is the kidneys. Early on when people come through our program at the Lifestyle Center of America, we check their indicators of kidney damage. We check a very sensitive measurement called microalbumin. It's looking for how much of a tiny amount of protein is in the urine. If there's an elevated amount, this shows that early kidney changes are occurring. We don't want to play games with that. We don't want to say, well, lifestyle, when you lose these 200 pounds and you stick with this diet for 2 years, your blood sugar will probably be fine. No, we want to say, look, if your blood sugar is not under control with lifestyle, after 2 weeks or so on our program, we're going to have you leave on medication.
So you actually sometimes put people on medication.
Sometimes I put people on medication.
But your ideal is to get them off that eventually.
Yeah, the foundation is lifestyle. Medication may be used in the short term if it's necessary, in the long term if that's the only option.
So you're not saying go home and throw out all my medications, but wisely consider what you really need for the short term with somebody who knows what they're doing.
That's exactly the message we're giving. I think the average American is not aware of all of the problems there are with medications on an individual basis. We've talked before about societal problems. We've talked about this misplaced focus that drug marketing and a drug emphasis has led to. We've talked about societal problems like antibiotic resistance and how that has fed into this culture of indiscriminate use of antibiotics. But Don, there are some real problems when it comes to the individual, when it comes to using medications.
Like what?
Let me tell you one of them.
Okay.
Allergies.
Allergies from medications.
From medications. Very common cause of allergies is medications. It can be anything from skin reactions to serious life-threatening reactions like anaphylaxis, a shock condition.
Where you stop breathing? Or...
Stop breathing, blood pressure drops down to next to nothing, and you can die. The leading drug in anaphylactic reactions on a recent review that I looked at was penicillin.
Penicillin.
Another study looked at the experience in another Western nation with drugs and liver injury, sometimes fatal injury. The leading drug that emerged in that study was erythromycin.
And this is because
Another
they're allergic
antibiotic.
to it and the liver reacts?
These are toxicities. In the case of the liver problem, this with erythromycin wouldn't necessarily be allergic.
It's because it goes to that organ and it's supposed to eliminate it from the body and it has problems doing that?
That can be one scenario, or the liver can be a target for the drug for other reasons.
To attack it because it's got disease-type things there it thinks it does. Something like that.
There's a variety of mechanisms why drugs have toxicity. One is an allergic mechanism. Okay, so that's sometimes involved in some of these things. And there are drugs that can cause what we call autoimmune liver problems. You can cause an autoimmune hepatitis from a drug. But these immune system allergy-related phenomena are one side of the picture, but then there are other side effects from the drugs that different tissues can be targets for that drug. The tissue, the nature of that tissue, whether it's the kidney, whether it's the liver, whether it's muscle. It doesn't have to be involved in the elimination of the drug. Muscle is a target for some of the cholesterol-lowering drugs. And some people who are susceptible to these drug side effects get problems in the muscle because of the drug.
Are there any common side effects that we have that we can prevent?
Clearly. One way, the best way to prevent any drug-related side effect is not to use the medication.
That makes sense.
And see, people, because these side effects are rare, I mean, they're often in the 2%, 5% range, less than 1%. People say, well, I take medications all the time, I never have side effects. But the list of side effects is growing and the list of concerns is growing. And Don, often in the life history of a drug, we become aware of side effects that we were unaware of it at another point in time. Take for example, aspirin. Most parents know today
you don't give it to your kids.
You don't give it to your kids because of Reye's syndrome.
Right.
Whether it's influenza or chickenpox, certain viral illnesses, if you give the kid aspirin, they can get fatal brain and liver problems called Reye's syndrome. But back in the 80s, before, we didn't realize that. And so aspirin, has it now become more dangerous?
No.
No.
It just always was dangerous.
It was always dangerous in these situations, but we didn't realize it. We're now starting to raise concern about many common drugs. Antidepressants, a number of them, concerns coming out in the medical literature, they may increase the risk of breast cancer. Does that mean we throw out the antidepressants? No, but we don't just say, well, look, any antidepressant for the rest of your life, that's fine. Calcium channel blockers, a category of drugs used for high blood pressure and heart conditions. There's some indication that these drugs may be associated with increased risk of intestinal bleeding, which can lead to hospitalizations and even death. So we're saying, well, is all the evidence there yet? Is this, dyed-in-the-wool medical science and fact? No, not yet, but the concerns are growing. And Don, here's the real shocker. Growing epidemic in our country, congestive heart failure. Now,
which means what?
I'm glad you're pinning me down on it, because I always try to let patients know, I wish we had a different term for this. You hear heart failure, you think the person has, got one foot in the grave, right?
Yeah.
Heart failure, we use that term medically, of course, when the heart has more work to do than it's able. And so congestive heart failure is a condition where the person's heart is just not able to pump as much as the body needs. And typically fluid will back up into the legs, maybe back up into the lungs. But here's the real shocker. Some recent research is suggesting that the common class of drugs called non-steroidal anti-inflammatory drugs, these are drugs like over-the-counter Nuprin, ibuprofen, Motrin, Clinaril, a whole host of these drugs.
Advil,
naproxen, the naproxen, all these drugs that we just take for any kind of pain, ache or pain, they may be actually contributing to heart failure. Preliminary studies, it's not fact yet. But when you start seeing these concerns, Don, I have to ask, and I have to tell my patients, look, when you take these things that you think are innocuous, they may be just as innocuous as aspirin was in its relation to Reye's syndrome. They were only innocuous in the perception of the consumer and the physician because we had not recognized the linkage with health problems yet.
But isn't that what they're supposed to do when they produce these drugs? Isn't this why they have the FDA and all these different companies that are supposed to be watch groups that look over the medication and whatnot?
You know, I have to tell you, Don, I'm thankful that we are fairly careful as far as what drugs are released on the market. We do fairly well. I'm not going to say we're perfect at not releasing drugs that cause sudden toxicity in lots of people. We're pretty careful about that. But all you've got to do, most people, if they've been on prescription drugs, they've gotten a call at some time from their physician saying, you know, this antiarrhythmic, this drug for your heart rhythm problem, just off the market. More people using it are dying than it's actually saving. Or people are dying from this pain pill, and you're on it, we need to stop it. Or this drug for your diabetes has caused some liver deaths, and you know, this drug is now off the market. And so people that have been on many medications and taking them for a period of time, this is where we especially need to be concerned, they know that these drugs slip off the market because what happens is over time, Don, we realize the problems.
It's a bigger study that goes on when everybody starts taking it.
That's exactly right.
And let me ask this, is it true also they may do a test on a particular medication, but then once you start taking it with the other medications you've already been taking, you've got a new mix or a new blend that they never studied?
This is another huge issue. Another huge issue is this whole area of drug interactions. And the more drugs we use, the more we increase the risk of interactions. And it's not just limited to drugs. You know, as we're talking about drugs and medications, you know, whenever I talk about medications, I know there are people listening to me and they say, yeah, see, look, quick, send this out because we're selling these nutrient supplements and quick, you know, have them watch Dr. DeRose and, you know, and hear what he's saying about all the side effects of drugs.
Because they need our supplement.
That's right. But supplements have their problems too. Not only with toxicities, but with drug interactions. These are real concerns. And now physicians are being urged to take not just a careful medication history on their patients, but to find out what herbs they're taking, what supplements they're taking. Some of these things are far from innocuous, especially because we take them in huge amounts.
What types of herbs and supplements do you especially caution people to avoid?
Well, maybe it's better expressed when we talk about what other drugs a person may be on. Let me give you a classic one, and that's the anticoagulant, the blood thinner, warfarin or Coumadin. Very common drug, and it does have some very important benefits. I mean, people that have had serious problems with blood clots, people that have serious heart rhythm problems, even though they feel well, like atrial fibrillation, which is a quivering of the chambers in the upper part of the heart. Coumadin, warfarin, can actually decrease the risk of a stroke.
The clots don't form.
Yeah, clots don't form in that quivering chamber and then flick off and go to the brain.
Okay.
So a very useful drug. But this drug, if you're changing what you're taking into your mouth, even if you make healthy dietary changes, you've got to be careful. If you start taking supplements, you've got to be very careful. In fact, you shouldn't do it without telling your doctor. This is something we're very mindful of at the Lifestyle Center of America because we have people start eating a better diet when they come. That means more green leafy vegetables. And that actually typically increases the need for warfarin or for Coumadin if people are going to keep their blood just as thin because the green leafy vegetables have lots of vitamin K, which works against these blood thinning medications.
So it's not as simple as saying no to medicines. You're saying you increase their blood thinner because they have increased their other plant-based medication, if you will, the green leafy vegetables. And so you really need to have the input of someone that's really been looking into this.
When you're on medications, you don't want to play games. If you've got serious medical problems, you don't want to just treat yourself. I'll tell you, there was a fellow that came into my office, not uncommon story, with bags of supplements. One of these individuals said, look, I'm stopping all these things because I think it's contributing to some of the problems I've been having. And that's not an underestimation.
We've been talking with Dr. David DeRose. We've been talking about medication. It's not a panacea. They are needed. You need the information that you can gain from people that have studied this and made this their life work many times. But just good common sense as well. One of the things that the doctor has been saying is look for ways to meet the objectives without medication. And don't just start medication without really thinking it through, whether it's prescription or over the counter. When we come back, we're going to further look at this issue, and I'm going to be asking the doctor about overdosage and different other situations that you may have heard of or maybe have experienced yourself. And we hope that you can join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Lettington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Lettington have been featured on 3ABM, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
We've been talking with Dr. David DeRose. We've been talking about medication. What is the wise way to utilize medication? What are harmful ways? What are ways that we need to be cautious or things we should avoid when dealing with medication? Doctor, another question that comes to mind here, you know, some people maybe are perpetuating the very conditions they want to avoid. Is this true when they take medications?
This is a very interesting question. A classic example has to do with headache preparations. This is true of over-the-counter headache medications as well as prescription drugs.
Usually very high in caffeine, right?
That's exactly right, and that's the catch. Many people have caffeine withdrawal headaches. And so what do they take to get rid of their caffeine withdrawal headache? Well, they take their pain pill that has caffeine in it. And there are some people in our country, it's not the majority, I don't think, that are avoiding caffeine because they're concerned about caffeine withdrawal headaches.
Yeah, not too many.
But here's what happens, though. Even in those people, the drug itself can be perpetuating the condition. You see, they take caffeine to get rid of the caffeine withdrawal headache, and then when the caffeine level drops, the caffeine withdrawal headache recurs, and then they take the caffeine-containing headache pill.
Boy, that's a pretty sneaky way to get your medication to be needed, right?
Well, I don't want to try to
question the
speculate
motives
on
here.
motives, right? But definitely there are patients who get into a vicious cycle where the medication is contributing to the problem. Headache is a classic example with these caffeine-containing preparations.
So if you're taking something for headache, make sure and look at it and say, hey, does it have caffeine? It usually says right on the side whether or not it has caffeine, doesn't it?
Labeling generally will disclose that. And talk with your physician. If you're being prescribed a prescription caffeine-containing pill, you may need to make a break with the caffeine for a while with the guidance of your physician. If you're being prescribed something, I say that. If you're just taking over-the-counter stuff, it's usually safe to make that break on your own.
Now, maybe some people are taking some medications and they're having side effects that they don't see as side effects, or they just don't even know they're having side effects. Is that true? And if so, what are those?
Well, you know, we've talked a lot, Don, about side effects that kind of creep up on you. For example, you know, we mentioned the calcium channel blockers and the risk of bleeding, perhaps. increased risk of congestive heart failure with certain pain-relieving drugs, or even the increased risk of breast cancer with certain antidepressants. Well, what kind of warning signs do people have with these things? I mean, do you, before you have a big bleed in your intestine, a big bleeding problem, do you have little blood spots that you'd find in your stool? No, not usually. Before you have breast cancer, do you start feeling your breast tingling because of the... No, I mean...
Silent.
So often these things creep up on you. One of the scariest ones to me, actually, Don, is tardive dyskinesia.
What in the world does that mean?
Well, I'll tell you, if you've visited a nursing home, you've likely seen people with tardive dyskinesias. They're usually, what they are uncontrolled movements, often kind of lip smacking or twisting movements of the face, and can affect the hands and other things. These are uncontrollable movements. It's usually irreversible, and they're associated with major tranquilizers. And unfortunately, many times in these extended care facilities, people are on large amounts of these. Now, people say, well, I feel sorry for Grandma that she's on these medications, but she's not aware of anything. So what's the, it's sad, but, we understand you got to keep her sedate. Here's the issue. These same class of medications are used by healthy young people. For example, Reglan, a drug that's used to regulate intestinal function, or Compazine, a drug that's used to treat nausea and other problems. These drugs are used often frequently and sometimes repetitively by people, and they are in this same class of major tranquilizers. They're not being prescribed for mental reasons, but they can cause these tardive dyskinesias. And the problem is, Don, people often don't have any warning.
It just comes up on them
and then it's irreversible.
Yeah.
So the message is, be aware that drugs carry with them side effects, and don't just say, what's the next pill I can take for this problem? Ask your doctor when he or she's prescribing a drug. Say, look, are there other options? Is there anything I can do with my lifestyle? Any changes I can make in my diet that may help me avoid this drug right now or down the road?
So, what you've said is two things. You've said when you take medications or change medications or think about doing something different in that area, talk to your physician. But now what you're saying is don't just listen to your physician and say, I want to put you on this next medication, but say, why? Is there any way we can avoid drugs altogether? And ask that question.
That's the message I try to give people. And it's a re-education, because what we're trying to say is we've got to move from this mentality as a society. If I have a problem, I've got to take a drug. There are problems for society. We've talked about this before with antibiotic resistance. There are problems for the individual, whether it's allergy, whether it's other side effects, and these are real issues that we need to talk about.
What about poisoning?
Well, poisoning is an issue that most people say, it's not really a danger for me. We've alluded to this in some of our discussions before, Don, but most people, they may be aware that alcohol is something dangerous when there's kids around. Most people are aware that prescription drugs should be kept out of the hands of children, but they don't realize that when you keep powerful drugs in your medicine cabinet, they may be at risk for you. If you get down, if you get depressed, you may be tempted to reach for that bottle of sleeping pills and maybe just try to, end it all. And so this is a real consideration. Some of these medications can be toxic when taken in large amounts and can be life-threatening.
Medications and accidents.
A lot of people, when you talk to them about accidents, you say, well, what kind of drugs cause accidents? Well, I say, illicit drugs. I mean, it's these drug abusers. Boy, someone, was driving wildly on the road, they're probably, taking cocaine or heroin. Actually, if you look at the statistics, workplace injuries, it's not illicit drugs that are causing the problem. It's things like alcohol and prescription drugs. Many of the drugs that we've been tempted to think are innocuous, and I say tempted, I think most people realize that medications are not as squeaky clean as we may like to believe. And so take, for example, anti-allergy pills, cold and flu preparations. These drugs with antihistamines often can impair performance. Very interesting study on the drug diphenhydramine or Benadryl. Very interesting.
I was just going to ask about Benadryl.
Yeah, you're going to ask about Benadryl.
Yeah.
You've probably seen some of the research that's come out lately, because people who have no apparent performance-limiting effects from this drug, Benadryl or diphenhydramine, which creeps into all kinds of over-the-counter preparations, their performance, when it's measured, is impaired. Behind the wheel, they don't drive as well. And if you talk about leading causes of accidents on the job, it's not some guy on a scaffold up at 500 feet. It's people
Benadryl.
behind the wheel, and it's often these common drugs, whether it's Benadryl or something else that's impairing our cognitive abilities, decreasing our mental faculties.
And I know it says it right on the package many times that these things can in fact happen, but most people just don't seem to get the message.
Well, you know what? We don't rely on what the message says, Don. You know what we rely on? Our personal experience. I feel fine, you know? Same with the person who says, I can handle my alcohol. Even a little bit of alcohol measurably impairs performance. It's the same with many of these medications.
It's almost as though there are really some kind of maybe even moral issues that are associated with how we choose to take medications and maybe how we as a country manufacture them.
You know, a lot of people would say this is taking the issue too far. But I've got to think of the example of our Lord. As he was on the cross on that dark Friday, he was offered an over-the-counter pain reliever. And what did he do?
I don't want it.
He didn't want it. Now, why not?
He wanted to be fully aware of what was happening.
That's right. He didn't want to suppress his mental faculties. How does God communicate with us?
Through our minds.
Through our mind. And so Jesus, as he's there, I mean, what kind of pain was he dealing with? On a spiritual level, on a physical level. And what do we pop pills for? I'm not saying we can never use a pain pill. I've been in situations where I myself have even taken a pain pill. Not typical, very unusual, but I was in a serious auto accident once, and I did take some pain pills. And there are situations in life where medications may be the best response we know. But too frequently, we resort to these things when there are better alternatives, and they would keep our minds clear for God's communication.
Reminds me of another story in Scripture about the first tempter in the Bible, that being the serpent, who said, take some of this and you'll feel better. Your mood will change. You'll get high, so to speak.
I mean, it's a beautiful analogy, because Satan was telling Adam and Eve to deviate from God's lifestyle program, deviate from this perfect plan he gave in Genesis. It included everything there, not just relationship with God, but diet, exercise, fresh air, sunshine. It was all there, these health-giving, life-giving benefits. And Satan said, no, take this. I'm not trying to say all drugs are a temptation from Satan. You know, we got to give that message.
But we got to be wise.
We got to be wise.
So you're not saying throw everything out.
Definitely.
But you're saying be wise about what you use, why you use it, how you use it, and consider all these issues. We've been talking with Dr. David DeRose. He's a physician at the Lifestyle Center of America. He helps people untangle their medication difficulties with the common illnesses that afflict Americans, heart disease and diabetes, and other things also are addressed there. We hope that you've enjoyed the program today, and we hope that you'll be wise in using your medications and directing and leading your family in that regard. And we hope that you do consult with those who really can help you if you have questions.